Today I am going to present muscles of mastication in a simpler way. Before we start, what do you mean by the word mastication? The word mastication means to grind, crush or chew the food with the help of teeth in order to swallow it. To learn the muscles of mastication, here is a small mnemonic. Teach muscles please. By taking all the starting letters, from T it means temporalis, from M it means masseter, and from P we have two muscles, lateral and medial pterygoids. What are the characteristic features of the muscles of mastication? So for every muscle we have to learn four things, that is origin, insertion, nerve supply and action. So here for the muscles of mastication also we will be going to learn all these. So these are the characteristics. All the four muscles of mastication should obey these all the four. Development. All the muscles they develop from mesoderm of first pharyngeal arch. Origin. They all should be in or around infratemporal fossa. Insertion. All the four muscles they are going to get inserted into the ramus of mandible. Nerve supply. All the four muscles of mastication they are supplied by mandibular division of trigeminal nerve. Action or movements. All the four muscles of mastication their main movement is the movement of mandible around the temporomandibular joint. Now we'll see about the origin and insertions of the muscles of mastication. Before that, we'll see some pictures. You remember them in this sequence so that it will be easy for us to remember the origin. Temporal fossa, zygomatic arch, infratemporal fossa, lateral and medial surfaces of lateral pterygoid plate, and the maxillary tuberosity. So first we'll see about the muscle temporalis. Temporalis, it originates from the temporal fossa. It gets inserted into the coronoid process of the mandible. Masseter, it gets originated from the zygomatic arch. It gets inserted into the ramus of mandible. Lateral pterygoid muscle. This muscle is a thick conical shaped muscle. The muscle it originates by the two heads, the upper head and the lower head. The upper head it gets originated from infratemporal surface and the crest of the greater wing of sphenoid, and the lower head it gets originated from the lateral surface of the lateral pterygoid plate. We will see this lateral pterygoid plate on the sphenoid bone. These both heads they get attached or inserted into the neck of mandible and the articular disc and capsule of the pterygomandibular joint. Medial pterygoid muscle it is quadrilateral in shape. It also gets originated from the two heads, the superficial head and the deep head. The superficial head it gets originated from the maxillary tuberosity, and the deep head it gets originated from medial surface of the lateral pterygoid plate. Here it is medial surface. They get inserted into the posterior inferior part of medial surface of the angle of ramus of mandible. The table for origin and insertions. For insertions we can have a mnemonic. CR is head, neck, joint, right. By taking the starting letters from C, R, neck, joint and R, we can get the insertions of the four muscles. Insertion C. C stands for coronoid process of mandible. R. It stands for ramus of mandible. Here neck. It stands for neck of mandible, and joint. Articular disc and capsule of temporomandibular joint. Right. R. It stands for ramus of mandible. Posterior inferior part of ramus of mandible. Actions: elevation, depression, protraction and retraction. For depression, the mnemonic is L left arrow. Here L stands for lateral pterygoid. The remaining three muscles, medial pterygoid, masseter and temporalis, they are used for the movement elevation. Now protraction and retraction. Only temporalis muscle is used in retraction, that too posterior fibers. Remaining all muscles they are used in the movement of protraction.